Hello, I'm Matt Norris. I'm a student physical therapist at Campbell University. Today I'll be demonstrating the Watson test for carpal instability. This test is used to assess dynamic carpal stability of the wrist, in particular the integrity of the scapholunate ligament. The scaphoid is the largest bone of the proximal carpals, linking the proximal and distal rows together as well as giving stability to the wrist. The proximal surface of the scaphoid is convex and articulates with the distal radius. The distal side articulates with the capitate and the flat side with the lunate. The lunate articulates between the scaphoid and triquetrum and the proximal row of carpals. This test is important because the most common dissociative instability is scapholunate dissociation, which is directly correlated with scapholunate ligament lesions. According to the research, this test psychometrics include sensitivity of 69% and specificity between 64 and 68%. Caution should be used with this test as approximately 1/3 of positive tests are actually on uninjured wrists. Therefore, it is important to assess both sides for consistency. Now I will demonstrate how to complete the test on a model. Begin by completely supinating the wrist, which in the end will leave you a little pronated, but that's okay. You'll want to bring the hand into ulnar deviation. Put your thumb on the scaphoid tubercle. Also placing your index finger on the dorsal aspect of the scaphoid, applying a dorsal pressure. The contralateral hand is used to stabilize the other metacarpals. Starting in ulnar deviation and slight extension, the wrist is moved into radial deviation and slight flexion. The normal kinematics of the joint when moving into radial deviation leads to the proximal row of carpals flexing forward and the scaphoid tubercle anteriorly into the clinician's thumb. The pressure given posteriorly prevents anterior movement of the scaphoid with dorsal pressure. When the scaphoid is unstable, the proximal pole will sublux posteriorly or dorsally. A positive test is reproduction of symptoms in the form of a click or catch or pain on the dorsal wrist, which is heard, indicating subluxation of the scaphoid due to instability. Hi, Rami.
Hello, Matt.
I know you've been having some wrist pain in your right wrist, so I'm just going to run a little test. I'm going to start on your unaffected side, test how it is, and then we'll move to your affected side just for a baseline, okay?
Okay.
So if you'll just bring your wrist over. So I'm just going to have you put your palm toward the ceiling.
Okay.
Alright. I'm going to bring your wrist in. I'm going to put my hand here. If anytime you have any pain or discomfort, just let me know, okay?
Will do.
Alright. Take you here. Any discomfort there?
Yep.
So nothing like you're feeling on the other.
No, not at all.
Okay. Now we'll try on the one that's affected. So perfect. You went ahead and you're in the right position. Just going to bring you over. I'm just going to bring you over. Is that giving you a reproduction of what you've been feeling, or?
Yeah, it's pretty similar.
Okay. So that clicking is what you've been getting. Okay. And this has been a demonstration of the Watson test.